Good afternoon, everybody. Today is April the 21st. It's 12 o'clock. My name is Alan Harris, the emergency manager here in Seminole County, coming to you from the Emergency Operations Center, where we have been active for about 4 weeks now, responding to COVID-19. Of course, as I always do, I want to certainly call out our Citizens Information Hotline. They answer all your questions daily, 7 days a week, from 8 a.m. to 5 p.m. And that telephone number is 407-665-0000. Again, 407-665-0000. And also our website, prepareseminole.org. Prepareseminole.org has all kinds of information for you. We keep that updated daily. We continue to update it regularly every single day, getting new information for you, trying to keep that as robust as possible during this very difficult time. I want to give you the numbers real quick, and I'm going to look over at my screen over here. We are currently at 329 positive cases of COVID-19 since the onset here in the county. And of those, 258 of those have completed their quarantine period. So they have no signs and symptoms, and they have completed their quarantine. So that's a very good number for us to report. Unfortunately, I have to report one bad statistic, and that is today we were informed of another fatality related to COVID-19, and that will make our sixth fatality here in Seminole County related to COVID-19. So our hearts go out to the friends and family of that individual, and certainly prayers are with them during this very difficult time. Inside of their homes, quarantined and isolated right now, we have 230 individuals, and those individuals, of course, are being serviced with food, water if necessary. And most of the time that's not necessary, but if there's a boil water notice or something like that in the community, which there has been a couple during this event, we've been able to get bottled water over to those individuals, medicines, medications, their general medications, as well as animal care. I'm very excited today to report some new testing sites coming online. The first testing site that I'd like to highlight is the Seminole Town Center Mall. That is a drive-in test site. You do need to make an appointment. That is sponsored by Advent Health, Stanford. They are doing a great job out there with the screening and the throughput. I've heard multiple great reports from folks that have shown up and gone through the line and just had a very, very good response to being out there. I also want to highlight our new site, and those sites are a roving site. Those sites are in specifically targeted communities, and today we launched that. And today we're in East Altamont. We're there from 10 to 2. And then we will be going to a different community each and every day. So on Wednesday, we will be in Midway. On Thursday, we will be in Goldsboro. On Friday, we will be in Lincoln Heights, Lockhart. On Monday, we will be in Bookertown. On Tuesday, we will be in Georgetown. And Wednesday, we will be in Jamestown. All of those tests are free, as well as the ones at the Seminole Town Center Mall. We are asking that if you have a medical insurance card, that you bring that medical insurance card with you. Again, remember, Seminole Town Center Mall does require reservations. The neighborhood-based sites do not require reservations. You can just drive into those test sites. It is first come, first served, so there is a wait there. So just know that when you come there, please be patient. It could be an hour or two before we can get to you, but just be patient and we will get to you. We're doing about 250 tests at the pop-up sites, and then up in Seminole Town Center Mall, they're doing even more than that through the drive-in sites. Of course, again, those are reservation only. For the test results from both sites are approximately 24 to 72 hours. So for the site in Seminole Town Center Mall is about 2 to 3 day turnaround, and then the pop-up sites we're expecting about 1 to 2 day turnaround. The pop-up sites are a nasal swab, and the Seminole Town Center site is a spit test. So they have a vial, and you just spit and cough into this vial, and then and that's how the items are collected. Along with those test sites, of course, we continue to work with the state on our regional test site. So if you'd like to go down to the Orange County Convention Center, there's no wait there. You can certainly do that. Of course, now there's many sites locally, but you can go down there if you wish to. If you're in the Oviedo area, you can certainly go down to the UCF test site. And the UCF test site also does require reservations. So you can go there to get tested if you wish over at UCF, just make a reservation. For the UCF test site, they are doing $250 a day, and you do need to bring your medical insurance. If you don't have medical insurance, then there is a $51 pay right there at the site, and then you can go ahead and get your test. Along with those sites, of course, we have our 22 other sites, and we are very excited to hear that CareSpot is now offering testing as well. So it is, of course, the 4 hospitals, as I've mentioned before, the 3 standalone emergency rooms, because the Heathrow emergency room, remember, is continues to be temporarily closed, but the other emergency rooms are offering testing. All the Advent Health Center cares are offering testing. The American Muslim Community Center is offering testing for those that are underinsured or not insured. CareSpot, CareNow is not doing testing. CareNow is not doing testing. CareSpot is doing testing. First Choice Urgent Care is doing testing. Nemours Urgent Care is not doing testing. So if you go there, that they are not a test site. True Health. So True Health is doing the pop-up sites, but they are also conducting testing in their 3 facilities. So they're continuing to do the testing in the 3 facilities as well as doing the pop-up sites. So the sponsors of the pop-up sites, I didn't mention that, is True Health, and we really thank them so much for their support. LabCorp and the Florida Department of Health in Seminole County. Urgent Care of Longwood is also providing tests. Sandra asked how many patients have cleared. Again, Sandra, that is, the numbers are updating really quick, 258. So 258 patients have cleared quarantine. So that means that they have gone through their symptoms and they have gone through their waiting period, and they are ready, they are back in the public. They can go to work, or they can go do activities like you and I. They can go to the grocery store if they need to, the hardware store, whatever they need to do to maintain their life. Connie asked, when is antibody testing available? So there was some antibody testing being done by Advent Health for a little while, and we've heard mixed if it was going to be available at the Seminole Town Center Mall. Now we're hearing it is not available there. So the reason for that, again, is the testing kits. So for the pop-up sites, we were right down to the wire. Yesterday we received 900 test kits here in the county from the federal government. We were very happy to receive those yesterday around 2 or 3. We weren't sure if the pop-up sites were going to be open today because of that, but they did come in time. But that's where we are. We're getting test kits daily and sometimes weekly. And in this case, we got a shipment yesterday, and which made us able to open up the test sites, of course, this week. So again, we will have those at those neighborhoods. But we were down to the wire. We were over the weekend. We kept calling the state and the federal government. Are they coming? Are they coming? Are they coming? And thank God, yes, they did come. They called us yesterday morning very early and said, hey, they're on their way from Tallahassee. We have a courier driving them to you because we know that you have the pop-up sites coming. And we were like, thank you so much. And they got here about 2 or 3 yesterday. So that is why we were able to launch it this morning. Pam asks, President says testing be free. Why do I have to pay? Again, our sites are free. So if you go to one of the pop-up sites, totally free. If you have your medical insurance card, then we would bill the medical insurance, but for you would have no copay whatsoever. No copay. Same thing for the Advent Health site. No payment whatsoever. Free test. Do bring your medical card with you. For the lab that's at UCF, they're trying to cover their costs, and that's why they're charging the $51. That's a private lab that's running that drive-through, so that's why they're doing that, Pam. Joyce asks, do I have to make an appointment? Yes, you have to make an appointment for the Advent Health site, which is at the Seminole Town Center Mall, and the UCF site. So you do need to make an appointment at both of those. Do you have to have symptoms? Joyce also asked, do you have to have symptoms? For our pop-up site, you do not. For the Advent Health, you do not. For the UCF site, let me look real quick here. Looks like you do not either. So now, those, and that's because we're starting to get additional test kits in. You did have to have them before, because there was just not very many test kits available. And now it's really good to see that those requirements are coming down, so everyone can go get a test if they wish to. The regional site at the Orange County Convention Center, no requirement. They just, the requirement is that you have to come in contact with someone with COVID-19. You do not have to have a fever or anything like that. They're not going to take your temperature. So as long as you've come in contact with someone with COVID-19, then you can go ahead and have a test. If you think you've come in contact with someone with COVID-19, if you know what I mean, you can probably go get a test. Where can we drop off donations like clothes and sneakers? Dorothy asked that. So we have our nonprofit partners that have been helping us since day one. The Harvest Time International. They do like food products. So if you have canned foods or things like that that you'd like to donate, the Harvest Time International has been doing an amazing job helping to feed the people at the Rescue Outreach Mission, our homeless folks, as well as they've been helping us with food for the individuals that are isolated and quarantined in their home. If you want to donate clothing, as Dorothy had asked, if you want to donate clothing, then the Sharing Center. The Sharing Center has been providing a lot of help to us. They're on 1792 in Longwood, so that would be a place you could drop off some materials. Also, Salvation Army has a drop-off location, and theirs is not manned, but you can just drop it off right there at the facility on 436. Amir asked, when will salons open? So, Amir, I'm really glad you asked that question. So, we in the county had an executive policy group meeting on Friday. The way our system works is we have an executive policy group that advises on what should happen in the community. That is made up of a medical doctor. Dr. Todd Husty is a medical director for the fire and EMS system, the health officer for the Florida Department of Health, the senior fire official, so the fire chief for Seminole County, the sheriff, the senior law enforcement official, the senior legal official for the county, so the county attorney, and the county manager, and then the senior elected official for the county chairman. And we all get together to discuss what our executive orders are, what should we do, and how should we plan to get businesses back open. And what we came up with on Friday was a good system. And right now the hair salons are closed, of course, because of the governor's order. Even if we said Seminole County, all hair salons are now open, we cannot trump the governor of the state of Florida. So it wouldn't matter if we said that or not, because that's listed as a non-essential business according to the state, not Seminole County. According to the state, we never listed a non-essential or essential business in our executive order ever. So they would be able to open. We have plans now. Whenever the executive order for the governor goes away, that absolutely Seminole County is poised and ready to allow hair salons to open, nail salons, car sales, test drives on car sales, anything that would have been that would have been hindered due to the executive order from the governor of the state. Will Medicare, Maddie asked, will Medicare, hey Maddie, how are you? I think I know who this is. Does Medicare cover the cost of the COVID test? Yes, you will be fine. Maddie, feel free to go get a test. We're trying to get a test site in your neighborhood if you're the Maddie I'm thinking of. So we're going to try to get one in your neighborhood. We're going to work with y'all to try to get one in your neighborhood. We need to get through these neighborhoods first, but we're going to try to get one in your neighborhood. Jamie, when are we going to be in phase one? I think that is a question that the entire state of Florida wants to know. There were, of course, some things that required to be in phase one according to the Opening of America guidance, and I'm just going to pull the guidance real quick. I have it right here, and I've been looking at it pretty regularly, so this is the guidance here. And So according to the guidance, it says that we have to have safe and efficient screening and testing. So that's what we're doing this week, right? So that's good. The health and safety of individuals in critical infrastructures, done here in the county. Health and safety for those living in high-risk facilities like senior care facilities. We are almost there. We are getting a shipment of personal protective equipment for assisted living facilities and nursing homes. And hopefully with this particular shipment, we'll have about a 15-day or a supply for 15 days for every facility. So we're hoping that that will come in today and we'll be able to get that. Protect the employees and users of mass transit. So we've been working with Sunrail and Lynx and they're ready. Social distance protocols on social distancing and face coverings, we have that. We have an executive order that talks about social distancing, so we meet that standard. Monitoring conditions for and mitigating additional outbreaks, we've done that. Quickly be able to identify and supply sufficient critical protective equipment, personal protective equipment, and critical medical equipment to handle a dramatic surge. We're not quite there yet, but we are working on that. So we've done a lot of things to get to where we need to be. So we're getting close to what I think we could be in phase one. So hopefully we'll get there soon. Again, it's up to the president has left that up to the governor of the state, and the governor will have to make a determination whether, what time it is that when he rescinds his executive order, or lets it expire. It could expire on the 30th. So if it expires on the 30th, then businesses would be able to completely reopen based on the state's law after the 30th. Cindy asked again about antibody testing. I wish I knew, Cindy, again, the testing kits, we just don't know, and Clyde asked the same thing. So we don't know when those tests are coming in. So we did hear about some antibody tests being done at the Mall of Millennia. That facility is closed down. So hopefully another facility will open up that's going to be doing antibody testing. We have been asking for it from the state, but right now we haven't received any of those. How many negative tests have we received, and how many patients that have been positive? I'll get that for you in just 1 second. Can you give me those numbers over there? Thank you, man. Appreciate it. Haley asked, do you partner with Hope Helps? Yes, we have, and we've actually, Hope Helps, for those that don't know, is a nonprofit organization, just a wonderful organization that helps with the homeless individuals, and yes, we've been working with them. We have actually housed some homeless individuals that have COVID-19. That again is one of the things we're doing here from the Emergency Operations Center. So we've housed those individuals. We've housed 3 of those so far, and 2 of those have come off of isolation and quarantine. We still have 1 individual that is still in isolation and quarantine, and hopefully that individual is doing very well, and hopefully they'll be released shortly. So we'll be able to they'll be able to get back into their normal life, Haley. So I appreciate that. So back to testing. So the question was how many negative. We have in the county 4,003 negative tests. We had 328, a total of 4,341 tests given. So if you think about our population, that's a very low percentage of individuals that have been tested. So we're hoping with these new sites that we'll be able to test a lot more individuals, and we'll get some really good numbers of what's going on out in our community. Again, that will also help us to get to whatever that phase 1 is and opening of America. Susie asked, do you suggest that everyone get tested? Absolutely. If you can do it. I can tell you the site out at Seminole Town Center Mall, we've had a couple people go through it, and it was so easy. They said they were only there for about 10-15 minutes. They pulled in, really quick service. You put your name on a printed piece of paper and your dash, and you just go right through. Very, very easy. A spit test, so very not invasive at all. So just really good and easy thing to do. That'll let you know at least today you don't have COVID-19, that you are not one of the asymptomatic people that may be walking around the community. So certainly that is helpful. Toshiba asks, with more testing, will there be more cases? So that is certainly something that could happen. So there will be two outcomes, right? We will either see that a lot of people are testing negative, which the percentage will be good, and that shows that less people maybe are getting it, or less people have it, or it'll show more positive people. So regardless, it will be good data for us, because that's what we need right now. We need data to determine how to move forward through this crisis. So we want that. So it's very helpful if people go get tested, and people certainly wanted to, because there was a lot of people at both facilities today. Teresa says some salons do house calls. So I have heard of that, and I can tell you the law enforcement agencies are not going and chasing down hairstylists going into people's houses. So whatever. If they do it, then I hope they do it safely, and I hope maybe they have a mask on. But if they don't, I would, if I'm going to get, well, I don't need to get a haircut. So, but if I do get a haircut, or maybe a beard trim or something, I would ask that the person that does it wear a mask. I wouldn't be able to wear a mask because you couldn't do my beard trim, right? So, but I'm not, we're not going to go chase down a hairstylist in someone's house, So if you, it's, try to do it safely, is all we're asking. CDC asked that. The World Health Organization asked that. I know some people are out there and they just don't care, and they don't care about social distancing. They don't care about they want everything. I get it. Back to the way it was, and we'd love to get back to the way it was, but we want to be safe. We want to be safe. So I get it. There's a couple people out there like that, and that's okay. But if you do have a hairstylist come in your house, try to be safe. Jenny says, any small businesses, and grant loans. Yes, so SBA, the Small Business Administration, has opened some grant loans. So you can look at that. We also know that some banks are now doing some grant loans. And let me see if I can get to the banks here. Because we did hear from some of the banks. Bank of America is accepting applications. Wells Fargo. If you don't get these, you can always, of course, replay this. And Seacoast. So those three, we've contacted every single one of those of the big banks, and those three are accepting applications right now. Again, Bank of America, Wells Fargo, and Seacoast. And then, of course, the Small Business Administration. Denise asks if you can get the virus again. So we have seen, we know of at least 2 cases where the individual tested positive, went through their completion period, and then tested negative, and then a couple weeks later tested positive. So we know that can happen. We have seen that happens. So what that tells me is if I'm positive, I'm just going to, be safe. I'm going to be careful. I'm going to be doing social distancing even once I get well. Mariana, is today the only day of testing at the Seminole Town Center Mall? Oh, no. So that one's going to be there for a while. The ones that are moving around the community, those are just for the day. But the one at the Seminole Town Center Mall, that one's going to be for about a week or so. So go online. It's you can Google Advent Health COVID-19 test, and they'll make a reservation for you. Very, very simple. We've heard lots of great comments from the individuals that can go over there. So you already asked about how to make an appointment, so I just answered that. So Lacey asked about rental assistance. There is rental assistance, so if you call our Citizens Information Hotline, they'll transfer you over to our Community Services Department, which is working on that. So 407-665-0000. Haley asked about a curfew. Seminole County has not had a curfew. We have no need to have a curfew. We have not listed an executive order for a curfew. We have no intention of ever doing a curfew. At least at this time, there's just not a need here in the county. When do driver's license tests resume? I know that Joel Greenberg is trying to open things back up. I had a conversation with him yesterday. I know the DMV's trying to do some things to get ready to open back up. So hopefully that will happen soon. Just keep a watch on both of their websites, and they can certainly help you with that. Can you carry the virus without symptomology? Eugene asked that. Yes, you can. You can be asymptomatic, and that's again why it's real important to get tested. What committee decides when youth sports can resume? Eduardo asked that. That's our Leisure Services Department. So our Leisure Services Department will make that determination for our organization and for the cities. Each city will have to determine when their youth sports are going to start back up. But that'll be done at the departmental level. So they have a team over there that works on that. Melissa asked, are we completely opening on April the 30th? So the executive order for the state of the state of Florida rescinds on the 30th. I do not know if he will extend it. At this point, if it expires on the 30th, then will we completely open? I don't think anyone has said that everything goes exactly back the way it was. There will still be social distancing in stores. There will still be markings on the floor. I know I will, and I know my friends and family will be wearing masks. I know that at the county we will be social distancing. We will be doing enhanced cleanings. We will have some folks that will work from home. So there are some things that there will be a new normal, and I don't profess to speak for all the businesses. They'll have to make their own decisions. Each individual business will have to do something separately based on what type of work they do. But I can tell you for the county, we are requiring masks for anyone that works in close proximity. For anyone that doesn't work in close proximity, 6 feet distance, social distancing, things like that. It is right about 12, actually a little over 12:25. I want to give you all time to get over to the Seminole County Public School Facebook Live. I hope this has been helpful. We certainly try to make this as informative as possible, and I try to get to all your questions. Those that I didn't answer your questions, I'm sorry I wasn't able to get to your questions, but we have a great public information staff that will follow up and make sure that your questions are answered. And of course, if you want something immediate, you can always call our Citizens Information Hotline, and they can certainly answer your questions at 407-665-0000. Y'all have a wonderful week. Stay safe.